Okay, this is maybe a more specific neuro assessment, but every nurse does this assessment anyway. It's your alert and oriented 1, 2, 3, or 4. And it's one of the first basic assessments you're taught as a nursing student. Are they alert to time, place, situation, and person? Most important, in my opinion, being person. If they don't know who they are, you got a problem. But there are, and often you'll get 2 or 3, ANO 2 or 3. That's kind of common. 1 to 2 sometimes you get, and obviously the norm or baseline you want is ANO 4. Some people actually still stick with ANO 3 as the norm. I believe situation was the most recent addition. Like OT nurses, they only went to 3 questions. But 4 is what we use. Most newer systems, even the MAR systems, Epic and Cerna, will go ANO 4 as the norm. The thing is, just make sure I have my bag. Go to work. If you didn't tell from the scrubs. There are occasionally people that can be ANO 4 and not with it. And I've had this discussion, not recently, but with nurses. They're like, well, you said they were ANO 4. And I was like, yeah, they are ANO 4, but they're confused. They're like, how can that be? And I said, go ask them the questions. They'll answer them, but then talk with them a little bit. Do your assessments. That's the thing with neural unit. We can, within a couple sentences, I can figure out, no, they're not with it. And I don't even have to get into assessments, but I do the assessments and I say, okay, you're ANO 4. I've had maybe like 4 patients like that. I'm sure it's going to be a lot. I mean, it's just that they can answer those 4 questions, whatever reason, but they are not with it. And it's, patient. I'm not talking about the psychotic patients, the ones that are really out of touch with reality, but still know them and their surroundings, but think they're Jesus Christ. And had those too. I'm actually excluding those. I'm just talking about just the quote unquote normal everyday. So you're going to get that. And the point of the video is you have your assessments. This is probably a little more advanced nursing, a little more advanced student nursing stuff where, this is what I mean by off the chart stuff. Yeah, the chart's going to say, you can tick off all the different boxes and whatever. You got AO4. And that's what I say when I give a report. And I say, okay, here's everything's on a chart. And a lot of times some of the older nurses or veteran nurses, I shouldn't say just older nurses, but the veteran nurses, they're like, yeah, right, get to the point. And what they want to know is what's off the chart. What's my assessment? What do I think? And then they'll assess too, and they'll compare. If there's a change in baseline, which is the key. NCLEX, exam, lab, change in baseline is the key. When there's a change in baseline, that's when your radar goes up. Just FYI, this is a little more student-y stuff that I rarely give out because I'm not very competent enough to do that. But this is basic stuff. It's like I did a couple NCLEX videos where I say, okay, this is the one question that you're always going to be asked and whatever. You answer this way. Go back and look. I don't even remember what the videos are. Sorry. But change in baseline is always something. Okay, whether it's good or bad, but typically it's the bad change in baseline. So always flag that up and go, what was that? So that's why we give report and we do that. We compare. Obviously an AO4 to AO2 is going to be a big thing. But it could be AO4, and all of a sudden, the change is confusion. They're confused. I was like, what? Where did that come from? Blah, 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 blah. They're AO4. But that's your assessment. That's what you have to make nursing notes. That's why we're allowed to make nursing notes. Make little comments and say, hey, look, this is what I'm seeing. Yes, they can answer these 4 questions. This is how, and you have to be able to back your your opinion up. And I think that's what a lot of the providers like about me, because they challenge me. They're going to challenge you. They're like, why do you think they need that? And I give them a nice long paragraph, and they're like, oh, okay, boom, there you go. Most nurses are like, I don't know, I get this feeling and whatever, da-da-da. Feelings are good, but you better back up that feeling with some kind of tangible evidence or something you can point to that they can hang their hat on. I mean, it's not that the providers are not willing to, but they're not willing to just on your gut feeling if you don't back that up. You got to back that up a little bit. They're like, well, this, and they did this. They were acting this way and they changed a little bit. I mean, it's just very subtle. And that's all you have to do. You say, look, there was a subtle change. Most people wouldn't pick up on it. It's just my gut that there's something wrong. That's all the provider's looking for. They're not just like, you got a hunch. What the frick is that? They could have hiccups. Well, they got hiccups and they have this, they did have this recent TBI and blah, blah, blah. And they're like, well, wait a minute. Okay, maybe there's some, pressure going on the brainstem. All right, let's do something. That's what you got to do. Even though it's just hiccups, hey, that's a sign, guys. Read into it. That's what you got to look at. So the providers are looking for something like that, and you will develop your skill set to that point to say, yeah, I got a hunch, I got a feeling, but you still have to back that up a bit. It's not just feelings, okay? So it's that the point of the video is just, don't just go by what the boxes tell you. Look a little deeper, ask a little more questions, feel them out. I mean, that counts. That's why we're allowed to make comments and all that. They could be AOx4, but crazy as F. Okay, so just a little more nursing stuff. Every now and then I have a little diamond in the rough somewhere. I'm like, oh, it's like that couple that found that big yellow diamond in Arkansas. I think they plant those things. Like what? No, I think I heard there was a rainstorm and it washed away and it cleaned it out. I say, hey, that's not a pebble, that's a diamond. So that's cool. Hopefully every now and then I could throw a little rough cut gem, and this is my rough cut gem for the month, maybe. Okay, take care, good luck.